Having insurance can be the difference between a life-changing surgery or living in fear and pain. I'm Zach Tawatari in Irvine, where volunteers are changing outlooks and changing lives. It's a life-changing day for these patients. Anaheim resident Guadalupe Zamido has been waiting over 30 years for the surgery she's about to undergo.
I'm so glad to find these plastic surgeons, and I'm so happy to stay here they're gonna do my surgery.
She's undergoing a breast reconstruction surgery she otherwise never would have been able to afford. Her doctor, Karen Leong, is volunteering her services for Mission Plasticos, a 20-year-old organization that, as part of their ReShaping Lives California program, provides plastic surgery to under or uninsured people that need the surgeries for medical reasons. Everything from this space in Irvine to the instruments are donated several times a year to make it possible for 3 to 4 patients per day to receive the services they need.
They've waited a long time. They've gone through so many struggles to survive the trauma or the cancer or the congenital deformity that they were born with, and to be given this opportunity to change their perception of themselves or what they find uncomfortable with themselves. I think that's where the real reward begins.
Post-surgery, at her home in Anaheim, Guadalupe's life story takes focus. She was just 22 years old when she found cysts in her breasts that were too expensive to get removed in the U.S. As a result, she went to Mexico to get the surgery done. What was supposed to be a simple surgery became a case of malpractice. She woke up missing part of her breast.
So many years back then, but it's still hard.
And until a few months ago, when she saw an ad for Mission Plasticos in a magazine, it was a pain she carried with her every day for the last 31 years. A pain she thought would never go away.
To find this magazine and then call them, and it's like a lie, a little lie for me.
Over 90% of the worldwide need for surgeries is in developing countries. But as Guadalupe can attest to, in the U.S., income and insurance are just as much a barrier as location to these services.
After all these years, it's like a miracle. It's a miracle.
Giving the gift of hope.